Good morning students. Today we'll see about gonimetry classes. What is gonimetry? A gonimetry used to for the medical field that measures the joint range of motion. It can be helpful in the determining if the patient is lacking the mobility due to injury or how well he or she is recovering after sustaining injury. In 1912, the physicist Max von Leu used the gonimeter to aid in the investigation of the atomic structure of crystals. It is used to a different purpose. In this physical therapy, the gonimeter used to measure the range of motion in patients. Therapists can determine what it's before therapy begins and how it is progress with therapy. First, we'll see about definition. What is the term gonimetry is derived from two Greek words, gonia. Gonia means angle, and gonia means angle, and metro means measures. So, gonimetry refers to measurement of angle. Specifically, can say that measurement of angle created human joints by bones of the body. Gonimetry may be used to determine the both particular joint position, the rotational mode of motion, and available of the joint. The gonimetry is important part of the comprehensive evaluation of the joint and surrounding soft tissues. Next, we'll go for importance of gonimetry. What are the importance of the gonimetry? They determine the presence or absence of dysfunction. Then establishing the diagnosis. Then developing treatment goal. Then evaluating progress or lack of progress towards rehabilitation goal. Modify treatment, motivating the subject, researching the effectiveness of specific therapeutic technique or regimens, fabricating orthosis and adaptive equipments. Competency in gonimetry. The use of gonimetry successfully, therapist acquires the following knowledge and develop the following skill. Recommended the testing position, alternate position, stabilization required, joint structure and function, normal infield, anatomical bone mark, instrumental alignment. Then we'll go for importance of infield gonimeter. The feeling is experienced by examiner and barrier to further motion. At the end of the passive motion is called infield. The amount of passive range of motion is determined by the orientation of particular joint. Some joints are structured so that joint caps will limit the end of the range of motion in a particular direction. In other joints, ligaments limit the range of motion. In other normal limitations, motion include passive muscle tension or soft tissue approximation or contact joint surface. So it's every joint in the body have normal characteristics infield, which is the specific for the joint. Due to abnormality in the joint, we will find another infield, which is called abnormal infield. Abnormal infield indicates a limitation of the range of motion of the particular joint. So during the measurement of the joint range of motion, it is necessary to understand the infield of a joint to direct accurate range. Then we'll go importance of positioning of gonimeter. The positioning of the gonimeter, one of the most important component of the gonimetry. Joint range of motions vary according to the different position of the body. In resting position, the range of motion of the joint can vary in the loading position. For example, the range of motion of the hip flexion with knee state is limited than range of motion hip flexion and with knee flexion position. That is why during the measurement of the joint range of motion, particularly recommended testing position from the measured. Step 1 is the place one gonimeter over the fulcrum of the joint. It will depending upon the joint you are measuring. Place the stationary arm gonimetry along with the stationary line of body. Then add the movable arm, the moving part of the body. Step 2, ask your patient to move the joint in desired direction. How the patient move the here fullest extent motion. Following the movement with the mobile arm to gonimeter, make sure the stationary arm stays straight. Step 3, stabilize the stationary arm portion of the body. This is a part of the body that is proximal, closer to the midline of the body. That is joint use testing. It is important the patient does not move the body while moving the joint is to isolate the movement of the accurate movement. Then step 4, look at the reading of the gonimeter before moving from the patient body. Ensure that you are take an accurate reading of the degree of the motion in the gonimetric measurement. Then we'll go for techniques of measurement. First techniques, the procedure and its purpose should be clearly explained to the patient. The relevant part of the body should be undressed. At the beginning of the examination, the position of the part should be stable and the standard position of the zero. If the patient is if pain is present, the starting position may have to modify the test given in the most comfortable position possible with the gentle handling. When possible, the motion should be compared with the opposite limb on side. The movement can be active or passive. If possible, both are used. The movement should be carried out slowly. Both limbs may be used to aid. Movement improves stability or pain trick movements.